Morning. Today we'll discuss about some of the important points in parasitology. Okay, so if you come across these words, you can make the diagnosis. So first, it is a flash-shaped ulcer, and if you come across this, that is ulcer most common in ileocecal and sigmoidal region, and the patient's presents with profuse bloody diarrhea and abdominal pain. It will be like same GI symptoms, okay, but the specific point here is the flask shaped ulcer and most common site. The probable diagnosis is amoebiasis, that is amoebic ulcer, okay, first. Second, so most common site is posterior or posterior surface of right lobe of the liver, okay, and anchovy sauce pus, that is chocolate brown in color. If you come across this, it is probably amoebic liver abscess. Anchovy sauce pus, it's a typical feature of amoebic liver abscess. So coming for third, so some of the differentiating features. If they given some of the cyst diagram, if the cyst contains 4 nucleus, it is histolytica, that is entamoeba histolytica. If the cyst contains 8 nucleus, then it is probably entamoeba coli, okay. So based on the nuclei, you can differentiate the cyst. So coming for next diagnosis. So first, it is causes primary amoebic meningoencephalitis, and in CSF there will be predominantly neutrophils. Just remember N for N, Naegleria fowleri and neutrophils, okay. So that's a sign called trial sign. So what is this? Nothing but in a culture plate or petri dish, there will be a lawn culture of an E. coli will be there, okay. So then you will be adding a sample. If in sample, if Naegleria is present, okay, what it will do is it starts feeding on the E. coli bacteria which is present in the lawn culture. So you can make a trial, that is you can make a way-like pathway, okay. So wherever the Naegleria fowleri feeds the E. coli, you can make a sign, that is called as a trial sign, okay. So there will be a lawn culture with E. coli. So then you will be adding a sample. If the Naegleria present in sample, it start eating or feeding, it start feeding the bacteria which is present in the petri dish, then you can make out the sign. So if you come across this trial sign, then probably it is in Naegleria fowleri, okay. So next it is so this organism typically causes granulomatous amoebic encephalitis. There is another organism like Balamutia mandrillaris. It also causes a granulomatous amoebic encephalitis, right? But if they have given a specific eye features like keratitis, so or any ulcer, if there is specific, they have mentioned the eye ulcer or something eye symptoms, okay. And in CSF, there will be predominant lymphocytes, whereas Naegleria, it is a neutrophil, whereas in here, in this condition, there will be lymphocytes. If you come across these points, then probably it is an acanthamoeba. So next, first point, it is in falling leaf motility, and the tropozoites will be pear-shaped or tennis racket. We know no tennis racket, okay, like this tennis racket shape. And the main complaints will be the malabsorption or steatorrhea, that is in fat which is not absorbed in the body, it will be released in the feces, and diarrhea will be very foul smelling with fat mucus, and there will be no blood, okay. So if you come across these points, you can go with Giardia lamblia, okay. So next, first point, it is in pear-shaped tropozoites, and there is an hydrogenosome which is specific for Trichomonas vaginalis, okay, because that is a respiratory organelle, and there will be a strawberry appearance of vaginal mucosa, and there will be a positive whiff test. So the probable diagnosis will be Trichomonas vaginalis. So next, If you come across leishmaniasis, so typically you will be finding like dum-dum fever, black fever. This is a splenomegaly, lymphadenopathy, hyperpigmentation, and the patient will be presents with pancytopenia, and then there will be hypergammaglobulinemia. Okay, so if you come across these symptoms or any ulcerative lesions, then it is in leishmaniasis. So next, non-ulcerative skin lesion, which occurs in the patient of visceral leishmaniasis following the completion of treatment. Okay, there will be typical history. There will be an ulcerative after taking the treatment for visceral leishmaniasis. The patient develops some skin lesion. What is the diagnosis means? That is post-Kala as a dermal leishmaniasis. Okay. So next, if you come across oriental sore, Delhi boil, Aleppo boil, Bogart button, it is a cutaneous leishmaniasis which is caused by Leishmania tropica. And Chichler ulcer, it is caused by Chichler ulcer or Bay sore. So oriental sore is caused by tropica and Bay sore is caused by Mexicana. Okay. So next it is in, if you come across these words like South American trypanosomiasis, Chagas disease, or Chagoma, or there will be unilateral swelling in the eye, that is an Romanas sign. There will be all will be mega, like mega esophagus, mega colon, and cardiomyopathy. And if you come across these key points, it is an Chagas disease. Okay, that is caused by Trypanosoma cruzi. So again, next it is an Winterbottom sign. That is an, what is that Winterbottom sign? Enlarged cervical lymphadenopathy. That's it. So Winterbottom sign or CNS manifestation. And then there is a sign called the Carandal sign. That is a delayed sensation to the pain. And there will be a mode cell. Mode cell is nothing but it is a morula. That is an 8-stage cells. It will be like that. And if you come across these words, it is a Trypanosoma brucei. Okay. So next it is an, if you come across this point, that is a Maltese cross form which is present in peripheral smear, probably diagnosis is BBC. So with these key points, you can make the diagnosis that you are confined to the particular organism. Okay. So thank you.